Hello, everyone, and welcome back to Life of Medical. Today, we're focusing on a piece of medical technology that plays a profoundly important role in health and early disease detection: the mammography device. For many, the word mammogram can bring a mix of emotions, perhaps some apprehension. But understanding this device, how it works, and why it's so critical for breast health can make all the difference. We'll explore everything from the basic procedure to advanced technologies like 3D mammography and the exciting future with AI. So, let's demystify the mammography device together. What is a mammography device? Let's begin with the fundamental question: what exactly is a mammography device? At its core, a mammography device, or a mammogram machine, is a specialized medical imaging system that uses low-dose X-rays to examine the human breast. Its primary purpose is for breast cancer screening and diagnosis. By creating detailed images of the breast tissue, it allows radiologists to detect abnormalities such as tumors, microcalcifications, or other changes that might be too small or too deep to be felt during a physical examination. These devices are engineered with features specifically designed for breast imaging, including paddles to gently compress the breast, which is crucial for spreading out the tissue to obtain clearer images and reduce the amount of radiation needed. The images produced, called mammograms, are then carefully analyzed to identify any suspicious areas that could indicate early signs of breast cancer or other benign breast conditions. It's truly a cornerstone technology in the fight against breast cancer, empowering early detection, which significantly improves treatment outcomes. How does a mammography device actually work? Understanding the how can really help alleviate concerns. So, how does a mammography device actually work? The process relies on the same basic principle as a standard X-ray. The mammography machine generates low-energy X-rays that pass through the breast. Different tissues within the breast, such as fat, glandular tissue, and any potential abnormalities, absorb these X-rays to varying degrees. The X-rays that pass through are captured by a detector, which can be a film cassette in older analog machines, or more commonly now, a digital detector in modern units. This digital information is then converted into an image that can be viewed on a high-resolution monitor. A key part of the procedure involves breast compression. The device has two plates, one that supports the breast and another, often made of clear plastic, that gently flattens it for a few seconds while the image is taken. While sometimes uncomfortable, this compression is vital because it spreads the breast tissue, reducing overlapping structures, which allows for a clearer image with less radiation. It also helps to immobilize the breast, preventing blurring from movement. Modern systems, particularly 3D mammography or digital breast tomosynthesis, take multiple X-ray images from different angles as an X-ray tube moves in an arc around the breast. A computer then reconstructs these images into thin, 1 mm slices, providing a more detailed, three-dimensional view. Why is mammography so crucial for breast health? The why behind mammography is powerful and life-affirming. Why is mammography so crucial for breast health? Its primary importance lies in its proven ability to detect breast cancer at an early stage, often before any symptoms are noticeable and when the cancer is most treatable. Early detection through screening mammography can significantly reduce the risk of dying from breast cancer. When cancers are found early and are small, treatment is generally less aggressive and more successful. This means patients may avoid more extensive surgeries like mastectomies or harsher chemotherapy regimens. Beyond cancer detection, mammography can also identify other non-cancerous, benign, breast conditions, such as cysts or fibroadenomas, which can provide peace of mind or guide further management if needed. It serves as a baseline for future comparisons, allowing doctors to track changes in breast tissue over time. Regular screening mammograms, as recommended by healthcare guidelines, empower individuals by providing the best currently available tool for proactive breast health management. This early warning system is indispensable in modern preventative medicine, contributing to longer, healthier lives for countless individuals. Who performs and interprets mammograms? When you go for a mammogram, you'll interact with a specialized team. So, who performs and interprets mammograms? The person who actually operates the mammography device and positions you for the images is a mammography technologist. These are radiologic technologists who have received specialized training and certification in mammography. They are skilled in patient communication, ensuring you understand the procedure, positioning the breast correctly to obtain high-quality diagnostic images, and operating the equipment safely and effectively. They play a critical role in making the experience as comfortable as possible while ensuring the technical excellence of the images. Once the images are taken, they are interpreted by a radiologist, who is a medical doctor specializing in diagnosing diseases and injuries using medical imaging techniques. Radiologists who interpret mammograms often have further subspecialized training in breast imaging. They meticulously examine the mammograms for any signs of abnormality, compare them to prior studies if available, and then generate a detailed report of their findings, which is sent to your referring physician or primary care provider. This collaborative effort between the technologist and the radiologist is key to the success of the mammography process. Where can you get a mammogram? Accessibility is key for effective screening. So, where can you get a mammogram? Mammography services are available in a variety of healthcare settings. Most commonly, they are found in the radiology or imaging departments of hospitals. Many hospitals have dedicated breast imaging centers or women's health centers that offer comprehensive breast care services, including mammography. You can also find mammography devices in standalone outpatient imaging clinics or specialized breast centers. These facilities focus specifically on imaging services and can be a convenient option. To further improve access, especially in rural or underserved areas, mobile mammography units are often utilized. These are specially equipped vans or buses that travel to different communities, workplaces, and community centers, offering screening mammograms on-site. This brings the technology directly to where people are, breaking down transportation barriers. Regardless of the location, it's important to ensure the facility is accredited, meaning it meets high standards for equipment quality, staff qualifications, and quality assurance practices, ensuring you receive the best care. Knowing when is crucial for proactive health management. So, when should you get a mammogram, and how do you understand screening guidelines? This is a question with recommendations that can vary slightly between different health organizations and depend on individual risk factors. Generally, for women at average risk of breast cancer, screening mammography is recommended to start annually or biennially, every 2 years, beginning at age 40 or 50 and continuing until at least age 74, or as long as a woman is in good health. It's vital to discuss your personal risk factors, such as family history of breast cancer, genetic mutations like BRCA1 or BRCA2, personal history of breast conditions, or breast density, with your doctor. They can help you decide on the most appropriate screening schedule for you. It's also important to distinguish between a screening mammogram and a diagnostic mammogram. A screening mammogram is done for women who have no symptoms, aiming for early detection. A diagnostic mammogram is performed when a woman has symptoms like a lump, breast pain, nipple discharge, or if a screening mammogram shows a potential abnormality that needs further investigation with more detailed views. The when is a personalized decision best made in consultation with your healthcare provider. Different strokes. 2D versus 3D mammography. Digital breast tomosynthesis. Technology in mammography has advanced significantly. Let's talk about different strokes. 2D versus 3D mammography, also known as digital breast tomosynthesis, DBT. Traditional 2D digital mammography takes 2 X-ray images of each breast, one from top to bottom and one from side to side. While effective, sometimes overlapping tissue can obscure small cancers or make normal tissue appear suspicious. 3D mammography, or tomosynthesis, is a more advanced technique. During a 3D exam, the X-ray arm of the mammography machine sweeps in a slight arc over the breast, taking multiple low-dose images from different angles. A computer then reconstructs these images into a series of thin, 1 mm slices. This allows the radiologist to see through layers of tissue and examine areas of concern without the problem of overlapping tissue. Studies have shown that 3D mammography can increase the detection rate of invasive breast cancers and also reduce the number of callbacks, instances where women are called back for additional imaging due to an unclear finding on a 2D mammogram. It is particularly beneficial for women with dense breast tissue, where cancers can be harder to spot on a standard 2D mammogram. Knowing what to expect can greatly ease any anxiety. So, here's a look at easing apprehensions. What to expect during your mammogram appointment. On the day of your exam, it's best to wear a two-piece outfit, as you'll need to undress from the waist up. Avoid using deodorant, talcum powder, or lotion on your breasts or underarm area, as these can sometimes show up on the X-ray as calcium spots. When you arrive, the mammography technologist will ask you some questions about your medical history and any breast symptoms you might have. In the exam room, you'll stand in front of the mammography machine. The technologist will position one breast at a time on the lower plate of the machine. The upper plate will then be lowered to gently compress your breast for a few seconds while the X-ray is taken. You might feel some pressure or discomfort, but it's usually brief. Typically, 2 views of each breast are taken. The entire procedure usually takes about 20 to 30 minutes. Remember, the technologist is there to help you and make you as comfortable as possible, so don't hesitate to communicate any concerns. After the exam, the images are reviewed by a radiologist, and the results will be sent to your doctor. The cutting-edge AI, contrast-enhanced mammography, and the future of breast imaging. The field of breast imaging is constantly evolving. Let's explore the cutting-edge AI, contrast-enhanced mammography, and the future of breast imaging. Artificial intelligence, AI, is making significant inroads. AI algorithms are being developed to assist radiologists in interpreting mammograms, potentially improving cancer detection rates, reducing false positives, and streamlining workflow. AI can help identify subtle patterns that might be missed by the human eye and can also help in risk assessment. Another exciting development is contrast-enhanced mammography, CM. This technique involves injecting an iodine-based contrast agent into the bloodstream before the mammogram. Cancers tend to take up more contrast than normal tissue, making them stand out more clearly on the images. CM can be particularly useful for women with dense breasts or for further evaluating questionable findings. Researchers are also exploring other innovative techniques like abbreviated MRI for screening, molecular breast imaging, and improved ultrasound technologies. The goal is always to detect breast cancer earlier, more accurately, and with greater patient comfort and less anxiety, personalizing screening approaches based on individual risk. The mammography device, in its various forms, is truly a remarkable tool in our ongoing efforts to protect and promote breast health. Understanding its function, its importance, and the advancements surrounding it helps us all be more informed advocates for our own health and the health of our loved ones. Early detection saves lives, and mammography is a key player in that mission. Thank you for joining me today on Life of Medical. If this video has helped you understand mammography better, please give it a thumbs up, subscribe for more insights into medical technology and health, and click the notification bell. Most importantly, talk to your doctor about your breast health and the screening schedule that's right for you. Share your thoughts or questions in the comments below. Stay informed, stay proactive, and take care.